Chapter 16 Estimation of Urinary Creatinine and Serum Creatinine. Creatinine is a cyclic anhydride of creatinine that is spontaneously produced as the final product of non-enzymatic decomposition of phosphocreatinine. क्रेटिनिन क्या है? तो एक साइक्लिक अनहाइड्राइड है किसका? ऑफ क्रेटिनिन, ठीक है। दैट इज क्रिएटिन का साइक्लिक अनहाइड्राइड क्रिएटिनिन। अब क्रिएटिन क्या है? दैट इज स्पॉन्टेनियसली प्रोड्यूस्ड एज द फाइनल प्रोडक्ट ऑफ नॉन एंजाइमेटिक decomposition of phosphocreatinine. फॉस्फोक्रिएटिन का डिकम्पोजिशन से बनता है क्रिएटिन। अनहाइड्राइड ऑफ क्रिएटिनिन से क्रिएटिनिन बन जाता है। It is excreted in the urine and the measurement of its excretion rates are used as diagnostic indicator of kidney function. Creatine is synthesized in the kidney, liver, and pancreas by two enzymatically mediated reactions involving three amino acids: arginine, glycine, and methionine. Okay, it is excreted in the urine and the measurement of its excretion rate are used as diagnostic indicator of kidney function. Creatine is synthesized in the kidney, liver, and pancreas by two enzymatically mediated reactions involving three amino acids: arginine, glycine, and methionine. क्रिएटिन कहाँ कहाँ बनता है? तो क्रिएटिन इज सिंथेसाइज्ड इन द किडनी, liver, and pancreas by two enzymatically mediated reaction involving three amino acids: arginine, glycine, and methionine. Creatine is then transported in blood to other organs such as muscles and brain, where it is phosphorylated to phosphocreatine, creatine phosphate, a high energy compound. Creatine phosphate is the source of a high energy phosphate bond for the immediate reformation of ATP by the action of creatine kinase. Creatine phosphate thus provides additional ATP during anaerobic muscular activity. Okay, about 2% of the total creatine is converted daily, so that the amount of creatine produced is related to the muscle mass and remains approximately the same from day to day unless the muscle mass changes. The amount of creatinine in blood is not affected by diet, age, or exercise. Calorimetric method. Principle. Creatinine, when treated with picric acid in an alkaline medium, is converted into creatinine picrate, which is an orange-red color compound. Jeff's reaction. The red color so produced has been found to be proportional to the amount of creatinine present. तो प्रिंसिपल क्या है कि जब क्रिएटिनिन को ट्रीट करते हैं पिक्रिक एसिड से, कौन सा मीडियम, अल्कलाइन मीडियम में, तो वो क्रिएटिनिन पिक्रेट में कन्वर्ट हो जाता है, जो कि ऑरेंज रेड कलर कंपाउंड है, और इसे जेफिज रिएक्शन कहते हैं। जो रेड कलर प्रोड्यूस होता है वो प्रोपोर्शनल होता है अमाउंट ऑफ क्रिएटिनिन। आगे देखते हैं रिएजेंट्स। पहला है क्रिएटिनिन स्टैंडर्ड सॉल्यूशन 100 मिलीग्राम पर 100 ml। डिजॉल्व 100 मिलीग्राम ऑफ क्रिएटिनिन in about 50 ml of distilled water and add to it 10 ml of 1 normal HCl. Dilute 200 ml with distilled water. Keep in a cool place in a well stoppered bottle. 1 ml of solution contain 1 milligram of creatinine. Working creatinine standard 2 milligram per 100 ml. Dilute 1 ml stock creatinine standard 250 ml in distilled water in a 50 ml flask. Working creatinine standard 2 milligram per 100 ml. Dilute 1 ml stock creatinine standard 250 ml in distilled water in a 50 ml flask. तीसरा है पिक्रिक एसिड सैचुरेटेड सॉल्यूशन। फोर्थ 10% सॉल्यूशन टंगस्टेट सोडियम टंगस्टेट। पांचवा है 2/3 नॉर्मल सल्फ्यूरिक एसिड। 6 0.75 नॉर्मल सोडियम हाइड्रोक्साइड। प्रोसीजर क्या है? लेवल 1 plastic centrifuge tube as T. Mark 2 glass test tubes as B and S. First step, black standard test distilled water 2.5 ml, standard 1.5 ml, test 1.5 ml. Working standard solution dash 1 ml, टेस्ट में नहीं डालना। सीरम 1 ml टेस्ट में डालना। 10% सोडियम टंगस्टेट 0.5 ml सब में डालना। 2/3%, 2/3 normal H2SO4 1 ml सब में डालना है। Mix and stand for 10 minutes. Centrifuge tubes T for 5 minutes to obtain clear supernatant. सेकेंड स्टेप में क्या करना है, ब्लैंक स्टैंडर्ड टेस्ट। सुपरनेटेंट को ब्लैंक में डालना है, 2 ml ऑफ ब्लैंक, 2 ml ऑफ स्टैंडर्ड, 2 ml ऑफ टेस्ट। पिक्रिक एसिड 1 ml सब में डालना है, 0.75 ml सोडियम हाइड्रोक्साइड 1 ml सब में डालना है। मिक्स वेल एंड स्टैंड फॉर 15 मिनट्स। रीड 8 ब्लू ग्रीन फिल्टर 540 नैनोमीटर। कैलकुलेशन mg of creatinine in serum per 100 ml is equal to OD of E बटे OD of S into 2। Concentration of creatinine in a standard solution, that is 2 mg per 100 ml. Serum creatinine by initial rate method. For use of semi-auto analyzer, manual assay procedure, spectrophotometric principle. Creatinine in alkaline medium react with picrate to produce orange color. This color absorbs light at 492 nanometer, 490 to 510 nanometer. The rate of increase in absorbance is directly proportional to the concentration of creatinine in the specimen. The rate of increase in absorbance is directly proportional to the concentration of creatinine in the specimen. Creatinine plus picrate alkaline medium क्या देता है, ऑरेंज कलर। रिएजेंट क्या रहता है, बॉटल 1 सोडियम पिक्रेट सॉल्यूशन, बॉटल 2 सोडियम हाइड्रोक्साइड सॉल्यूशन, बॉटल 3 क्रिएटिनिन स्टैंडर्ड 2 mg per deciliter. Mix equal volume of solution of bottle 1 and 2 to make working solution. Concentration of working solution composition: sodium picrate 7.7 mol per liter, sodium hydroxide 500 millimole per liter. Pre-warm and required amount of working solution to room temperature before use. 1 ml procedure. Working solution 1 ml, standard or sample 50 microliter. Add 50 microliter of standard solution to 1 tube of working solution. Add 50 microliter of standard solution to 1 tube of working solution. Mix and put into cuvette of spectrophotometer and start a stopwatch. Record the absorbance at exactly 30 seconds after a standard addition and then again at 90 seconds. Add 50 microliter of standard solution to 1 tube of working solution. Mix and put into cuvette of a spectrophotometer. And start a stopwatch. Record the absorbance at exactly 30 seconds after a standard addition and then again at 90 seconds. Add 50 microliter of serum sample to another tube of working solution. Mix and put into cuvette of a spectrophotometer and start a stopwatch. Record the absorbance at exactly 30 seconds after sample addition and then again at 90 seconds. Calculation. Calculate the rate of change in absorbance per minute of a standard and test specimen. Serum creatinine milligram percent is equal to change in absorbance of test beta change in absorbance of a standard into 2. चेंज इन absorbance कैसे निकालते हैं? तो absorbance at 90 सेकेंड माइनस absorbance at 30 सेकेंड. Semi-auto analyzer assay procedure. Each analyzer has its own set of assay programs. Please follow the procedure given with the test kit. The instrument has to be calibrated for the first time using the creatinine standard provided with the kit. Then subsequently the test sample has to be introduced one by one. Note: the analyzer does the same calculation as is done using the manual method. Okay, and then subsequently gives the result of the test samples. Question answer देख लेते हैं. What is the normal serum creatinine level? मेल में 0.7 से 1.3 मिलीग्राम पर डेसीलीटर होता है. फीमेल में 0.4 से 1.2 मिलीग्राम पर डेसीलीटर. Why is the normal serum creatinine value higher in male than in female or children? As the amount of creatinine formed and excreted depends on the muscle mass. Males with larger muscle mass have higher normal values. What is creatinine? Creatinine is an anhydride of creatine present in muscle. Its formation is spontaneous. Name 3 amino acids involved in formation of creatinine. The 3 amino acids are glycine, arginine, and methionine. Name the conditions in which serum creatinine level is increased. Answer: first, impaired renal function, as in chronic nephritis, urinary tract obstructions due to stone, or enlarged prostate, muscle disease, gigantism, acromegaly, myasthenia gravis, muscle dystrophy, poliomyelitis, congestive heart failure, shock, dehydration, decreased renal blood flow, decreased GFR. अच्छा, नेम द कंडीशन इन विच सीरम क्रिएटिनिन लेवल इज इंक्रीज्ड। तो कब कब इंक्रीज होता है? पहला, इम्पेयर्ड रीनल फंक्शन, एज इन chronic nephritis, urinary tract obstruction due to stone or enlarged prostate. दूसरा, मसल डिजीज, gigantism, acromegaly, myasthenia gravis, muscle dystrophy, poliomyelitis, congestive heart failure, shock, dehydration, decreased renal blood flow, decreased GFR. Name the conditions in which serum creatinine level is decreased. A small stature, decreased muscle mass, advanced and severe liver disease, pregnancy, increased GFR. Okay. Next question 7. Why is serum creatinine estimation preferred over blood urea estimation for detection of renal disorder? Why is serum creatinine estimation preferred over blood urea estimation for detection of renal disorders? Serum creatinine value depends on the muscle mass of the individual, and also its daily excretion is fixed. On the other hand, urea value is influenced by pre-renal conditions like A. Intake of high protein diet, B. Increased protein catabolism, sample fever, C. Absorption of blood protein products after GI hemorrhage. Question number 8. What are the distinguishing features of globular dysfunction and tubular dysfunction in the kidney? What are the distinguishing features of glomerular dysfunction and tubular dysfunction in the kidney? Glomerular dysfunction, tubular dysfunction. ग्लोमेरुलर डिस्फंक्शन में ब्लड यूरिया बढ़ जाता है, ट्यूबुलर डिस्फंक्शन में यूरिन कंसंट्रेशन घट जाता है। सीरम क्रेटिनिन बढ़ जाता है और यूरिन डाइल्यूशन टेस्ट क्या है, उसके बाद इंसुलिन क्लियरेंस कम हो जाता है, नॉर्मल क्रेटिनिन क्लियरेंस कम, यूरिक एसिड एक्सक्रीशन कम हो जाता है। तो यूरिया क्लियरेंस कब हो जाता है? सिर्फ यूरिक एसिड बढ़ जाता है। प्रोटीन इन यूरिन present acidification of urine volume decrease, urine volume increase, gravity, specific gravity increase, specific gravity decrease. What are the newer markers of renal function tests which help in diagnosis of clinical disorders? As markers of renal function, creatinine, urea, uric acid, and electrolyte are for routine analysis, whereas several studies have confirmed the usefulness of markers such as cystatin C, B-trace protein, and beta 2 microglobulin. Cystatin C provides an excellent tool for the early detection of kidney disease and is a good indicator of GFR. The protease inhibitor cystatin C is a non-glycosylated low molecular weight protein. It has been proposed to be a marker as it produced by all nucleated cells at a constant rate and is freely filtered by the glomeruli and completely catabolized in the proximal tubules. Estimation of creatinine in urine. Creatinine in urine comes mainly from creatine of the skeletal muscles. Creatinine in urine comes mainly from creatine of the skeletal muscle. The amount of creatinine eliminated in urine varies with the muscle mass. Its daily excretion is nearly constant for each individual. On an average, the normal excretion of creatinine in an adult varies between 1 to 1.5 gram per day. Increased excretion occurs in wasting disease, prolonged starvation, fever, etc. due to breakdown of muscle. Disease of muscle such as progressive muscular dystrophy, myopathy, amyotonia congenita, etc. are frequently accompanied by increased excretion of creatinine in urine. Urinary creatinine estimation is commonly carried out as part of creatinine clearance test. Nowadays, estimation is done using the Jeffries endpoint or kinetic method suitable for automated analysis. Urinary disease of muscle such as progressive muscular dystrophy, myopathy, amyotonia congenita, etc. are frequently accompanied by increased excretion of creatinine in urine. Urinary creatinine estimation is commonly carried out as part of creatinine clearance test. Nowadays, estimation is done using a Jeffries endpoint or kinetic method suitable for Automated analysis. Foulin's method. प्रिंसिपल क्या है? तो क्रेटिनिन when treated with picric acid in a alkaline medium is converted into creatinine picrate, which is a orange red color compound. Jeffrey's reaction. The red colors of produced has been found to be proportional to the amount of creatinine present. Reagent: creatinine standard solution. Dissolve 0.1 gram creatinine or 0.1611 gram of creatinine zinc chloride in about 50 ml of distilled water and add to it 10 ml of 1 normal HCl. Dilute to 100 ml with distilled water. Keep in a cool place in a well-stoppered bottle. 1 ml of solution contain 1 milligram of creatinine. Saturated solution of picric acid about 1%. 10% weight by volume sodium hydroxide solution. Procedure. Label 3 test tubes. Mark U unknown, S P standard and blank. Into U measure 0.1 ml urine and in S 0.1 ml of standard and solution of creatinine, and B put 0.1 ml of distilled water. To all the tubes add 0.2 ml of 10% sodium hydroxide and 2 ml of saturated solution of picric acid. Mix and allow them to stand for 10 minutes for the color to develop. Then add 2.6 ml water. Mix well and read OD in photoelectric colorimeter at 540 nanometer blue-green filter. If daily excretion has to be found, an accurate measurement of 24-hour volume of urine has to be made. An analysis has to be done on an aliquot taken from mixed 24-hour amount. For rough idea of daily excretion of creatine, an average of 2000 ml of urine in winter and 1500 ml in summer may be taken as daily output for the purpose of this exercise. Let US be the optical densities of unknown standard blank in the photoelectric colorimeter. Creatinine in 100 ml urine is equal to U minus BS minus B into creatinine in 100 ml standard, or creatinine in 100 ml urine is equal to U minus B upon S minus B into 100 mg. B. Urine creatinine by initial rate method for use on semi-auto analyzer manually. Manual assay procedure, spectrophotometric principle. Creatinine in alkaline medium reacts with picrate to produce orange color. This color absorbs light at 492 nanometer, 490 to 510 nanometer. The rate of increase in absorbance is directly proportional to the concentration of creatinine in the specimen. Creatinine plus picrate alkaline medium orange color. Sorry. Reagent: bottle 1 sodium picrate solution, bottle 2 sodium hydroxide solution, bottle 3 creatinine standard 2 mg per deciliter. Mix equal volume of solution of bottle 1 and 2 to make working solution. Concentration of working solution. component sodium picrate 7.7 mol per liter, sodium hydroxide 500 millimole per liter. Pre-warm the required amount of working solution at room temperature before use, as urine has a high content of creatinine. It has to be diluted before the assay. Dilute the urine sample 20 times with normal saline 1.9 ml. Add 100 microliter of urine and mix 1 ml procedure. Working solution 1 ml. Standard sample 50 microliter. Add 50 microliter of standard solution to 1 tube of working solution. Mix and put into cuvette of a spectrophotometer and start a stopwatch. Record the absorbance at exactly 30 seconds and after standard addition, and then again at 90 seconds. Add 50 microliter of dilute urine sample to another tube of working solution. Mix and put into cuvette of a spectrophotometer and start a stopwatch. Record the absorbance at exactly 30 seconds after sample addition, and then again at 90 seconds. Calculation. Calculate the rate of change in absorbance per minute, delta ABS of a standard and test specimen. Delta ABS is equal to ABS at 90 seconds minus ABS at 30 seconds. Serum creatinine milligram percent is equal to delta absorbance of test change in absorbance of a standard into 2. Multiply the result obtained by 20 dilution factor. ओके फ्रेंड्स, तो ये चैप्टर कंप्लीट हो चुका है। नेक्स्ट चैप्टर है 17 एस्टिमेशन ऑफ क्रिएटिनिन क्लियरेंस, इसको देखेंगे। तब तक के लिए बाय। हंसते रहिए, मुस्कुराते रहिए और पढ़ाई करते रहिए। बाय बाय।